The views, thoughts, and opinions expressed in this episode are that of the guest and host and do not necessarily reflect the values of sponsors or other associated organizations. Welcome to the Parental Compass. I am your host, Bobby Williams. Wherever you're listening to this episode right now, I encourage you to look us up on Apple Music or Spotify. Just search the Parental Compass, or you can go to our website, parentalcompass.org. As always, I want to give a big shout out to Family Education and Support Services, the creators of this show. This is an important episode, not just for any parent, but any individual in the world, basically. We're talking about the COVID vaccine. My guest today is Dr. Akavan. Dr. Akavan is a board-certified physician in family medicine. He works with the University of Washington and with the health insurance company Amerigroup. So I didn't hold any punches with this one. I just wanted to get to the raw, real information. And I feel like that's exactly what we did. So let's get into it. We're all filling a lot of different roles in life. Parent, coworker, friend. Well, Amerigroup offers whole care for the whole you. It's all covered. Doctor visits, prescriptions, extra vision benefits, and even help getting your GED. Visit chooseamerigroup.com/WA. A common concern I hear from people is that this vaccine came out so quickly. Within a year, they had it ready to go. And so the feeling is like, well, how can I trust this thing? It came out so fast. What would you say to quell people's fears about that?
Sure, there's valid reasons to be concerned whenever a vaccine or medication is developed so quickly. But to give your reassurance to the general public that these vaccines have gone through rigorous testing, even though they haven't been very long. I know the two vaccines, the Pfizer and the Moderna one, had over 75,000 volunteers that went through a clinical trial phases, and they were tested for safety and efficacy. In addition to that, the data was reviewed by a federal data vaccine agency, as well as the Western State Scientific Assembly that looked at the safety and efficacy. So even though it's not ideal, in medicine, we looked at what is referred to as risk versus benefit. And whenever the benefit farly outweighs the risk is when we decide to move forward with something. And in this instance, I think that's why it had to be developed and implemented quickly, because time is of essence.
Yeah. Well, do you think 5 years down the line, 10 years down the line, we might be discovering new side effects from this medicine? Or I think that's where the fear is.
Well, in medicine, we can never say for sure. We never say never, but it's because we just don't have the data to say for sure. But it's unlikely that a lot of the vaccine ingredients and development is no different than other vaccines. So there's good confidence that there's no severe side effects in the long term. However, we, of course, are going to be monitoring this. And if there is something concerning, the CDC will be reporting this to the public agencies to be notifying the general population. But at this point, we don't know. But based on what we know, I would say that it's less likely to have any severe side effects.
Yeah. How did they even develop this? Because the way I understand vaccines to work is you have a disease, you take a little bit of that disease and then inject it in someone and they build the antibodies around it. But I've heard this vaccine doesn't even contain COVID. I guess, what are the specifics of how is this working, or how did they create this thing?
Sure. I mean, you're correct. Mostly vaccines are developed by putting in some type of a variation of the virus, an activated virus or even a live virus. And this vaccine is sort of unique in a way that They use a technology called mRNA, messenger RNA. And what it does is basically gives your body a recipe to start creating a protein that is very similar to what's found on the COVID virus. And as your body is producing this protein, what we refer to as a spike protein, then your body starts developing antibodies, which is what we refer to as fighter cells. And once your antibodies are developed, then when you actually do acquire the virus, then your body has enough protection to fight against the virus. So the mRNA portion of it is relatively a new innovation, even though it's not brand new. It's been used in other fields of medicine, just not routinely in vaccines. So it is a leap forward in the scientific world where you can develop the vaccine a lot quicker and you can mass produce it a lot faster than a traditional vaccine, which takes a lot longer.
Have there been any side effects, or has anyone died from this vaccine as far as you know?
So there hasn't been any deaths reported directly as a result of getting the vaccine, according to CDC. But there has been some side effects, mostly, we'll talk a little bit about the common side effects and then severe side effects. The only severe side effect so far has been a severe allergic reaction. So if you have a history of severe allergic reaction, you have to just let your provider know to have that discussion about what to look out for and be more cautious. However, the more common side effects are just like any other vaccine. You get a local soreness in your arm. You'll get some fatigue. You'll get some headaches and muscle ache. And these are the most common side effects you notice within 2 days of getting the vaccine, and usually resolves within a day. And these are usually more common after the second dose of the vaccine. Mm-hmm. Besides that, there's no severe side effects besides this allergic reaction that's been really documented.
Yeah. My fear, it seems like as soon as this vaccine came out, all these new variants started popping up around the same time. And so I wonder, is this vaccine going to work against the variants? Or are we going to get stuck in this battle with nature where it's like the vaccine gets a little better, COVID gets a little better, and we're constantly, what do you think about the variants?
Well, the variants are certainly concerning. There are new variants, different types of variants that are coming uprising from different countries. And as these variants are developing, there's a lot of research going on right now to see how effective the vaccine is against the variants. And there's some mixed results now that there's some good protection. However, we can't say with confidence that they are full protection. So it's still being on the side of caution that all safety measures like mask wearing, social distances should still be in place until we have more data. But it is possible we're in a scenario that as we develop, vaccines, even booster vaccines, that these variants will continue to evolve. So it almost feels like you're always playing catch up, similar to the flu shot. So we don't know yet, but we know that what we have currently is very effective to the COVID vaccine, the traditional strain of the COVID.
Yeah. You think this will become the flu, like COVID will be the new flu?
It's very possible that it will continue to produce different mutations over time, and we think that COVID will be with us for quite a long time. And whether we totally eradicate it, we don't know. We feel like we have a pretty good shot at it. It just depends also on quickly people get vaccinated. The more people get vaccinated and we reach herd immunity, which is typically around 70 to 80% of the population, the more likely we can really stop the transmission where the virus has nowhere to go. So at this time, we can't say for sure if it's going to be around like the flu every year, but there's always a possibility.
Yeah. Another argument I hear being made is like, well, if your vaccine works for you and your kid, why do you need me and my child to get vaccinated? What's your response to that?
Well, that goes back to the herd immunity question. Is in order for this to be very successful, we all need to get vaccinated, meaning that 70 to 80% at a minimum of the population needs to be almost to a point where the virus again has very low transmission chances. It is possible that if you get the vaccine, you're protected, but it also doesn't mean that you're not able to carry the vaccine. So you can still be a carrier and pass that virus on to someone else who may not be vaccinated. which is important, which is why it's important to pass the message that this is really a cohesive sort of effort for everyone to be on the same boat.
Yeah. So I hear you can even get COVID once you've had the vaccine. Is that true?
So theoretically, you can still get COVID. What COVID does, I mean, I'm sorry, the vaccine does, it will protect you from severe illness. So your body is much more likely to fight COVID, be well protected, um, and a lower chance of acquiring COVID, but you can still acquire it and you can still carry it and you can still pass it on to others. So it is kind of a myth to say that I got the vaccine, I'm never going to get COVID again. It's still possible. Remember, the vaccines are about 94 to 95% effective. That means they're not 100% effective. So in theory, 1 out of every 20 people could still acquire the virus and to get mild and severe symptoms. So we have to keep that in mind always.
Yeah. So even once you get the vaccine, it's not like you can just jump back into regular life and like throw out all your mask or.
Correct. I mean, for two reasons. One is because of the fact that we have not reached herd immunity at this point. And the second reason is that with all these new variants, we just don't know how effective the vaccine is. So I've heard this analogy used before. After you get your first shot of the vaccine, it's similar to wearing a mask, which is about 50% protection.
Hmm.
And when you get the second dose of the vaccine, it's almost like wearing a hazmat suit when you're 94, 95% protected. So, and that's only 2 weeks after you get the vaccine. So, until that is done, I believe all the safety measures need to be taken.
Yeah. Here's another common one, which is say you've already got COVID once, you've recovered. Do you still need to get the vaccine or should you?
Yes, the recommendation is to get the COVID vaccine even after you have acquired COVID. The reason behind that is after you acquire the virus, you develop what we call natural immunity. Some antibodies start to build up after you acquire the virus, but we don't know how long that immunity is good for. The best guesstimate at this point is about 2 to 3 months. So we don't believe that it has a long-term immunity against the virus. The vaccine has a much higher likelihood to protecting you longer term. So even if you get the virus, you still are recommended to get the vaccine.
Hmm. There's a lot of mixed information about children and COVID. On one hand, we want all the kids to get back to school, but then it almost seems like schools could still be super spreader locations. What's your stance on that? Because I just hear so many mixed things.
Sure. So you always hear the stories that there is some spread at the school basis. However, if you're looking at this from a larger pool of data, the transmission within the school systems are relatively very low. If proper measures are taking place, if you have the masking, social distances, clean hand washing, the transmission is actually quite low at the schools, which is why it was recommended that the benefit of opening our schools for our children is better than keeping them at home because the rate of transmission is so low. Having said that, I believe down in the future, the children would also be vaccinated to add an extra measure of protection for them when it's indicated. As you well know, that the vaccines are not safe for children at this time based on the data we have. But I know that there's current studies going to make sure to test enough children to make sure that they also can get the vaccine one day.
Yeah. Do you think one vaccine is better than another? Are they all created equal?
So, they're essentially very similar. We have the Pfizer vaccine, which is 95% effective, and the Moderna vaccine is 94.1%. So essentially very, similar effectiveness. These are much higher rate of effectiveness than we have with the flu vaccine and some other vaccines. So it is quite remarkable in a short period of time that the scientists came up with a vaccine that is so highly effective. But for the sake of argument, they're very similar.
Say I get the first vaccine shot, something comes up, or there's a supply issue, or something happens, and I can't get the second one in time. What do you do?
That's a valid concern. This idea of mixing the two different types of vaccine is being tested. At this time, it's not recommended to interchange the two doses of vaccine. So it's preferred if you start with the Moderna vaccine, you should get the second Moderna vaccine 28 days later, and same thing with the Pfizer. So it's too early to say. But even if we had to choose that we could not get the second dose, I would still recommend people to get the first dose because of the earlier reasons I said, that you're still getting 50 to 55% protection, which is better than no protection at all. And at a later phase, if the second dose becomes available, you should go ahead and complete the whole series. But it's not ideal to wait, but if that's what it comes down to, I still would move forward with it.
So you could even still get it 3-4 months down the line and it would still be worth it and it wouldn't hurt you in any way.
No, theoretically, it would be as effective, even though they haven't studied it and what happens if it's 3 to 4 months later. But it should cause no harm if you were just to wait longer, as far as the side effects or any other health concerns.
Yeah. Well, dang, I was hoping it would just be like, get the vaccine, we're good to go. Let's all go to the concert next month or something. But it sounds like, from what you're saying, this is still going to be an active challenge going forward. You think we'll ever get back to life how it was before COVID?
Yeah, that's a great question. Obviously nobody can predict, but I think from my personal belief is that there is going to be some adjustments and changes on how we live, forward post COVID. I'm an optimist that things will get a lot better, and that will be at least a lot closer to what we used to be, as normal as it can be. But I feel like there'll still be some adjustments and changes going forward that we'll all be expecting.
Yeah. Well, we still got a long road ahead of us, but hopefully we've made it through the worst of it. Any final words of reassurance to someone who may be on the fence about getting the vaccine?
I would say that one of the most important things is, if you are looking for information on, whether vaccine is safe or any other questions you have, just make sure that when you're reading some of these posts or answers online, to make sure it's coming from a reputable source. That's it's always a danger when there's bad information out in the general public that can lead people to believe that certain things are true, which are not. Websites like CDC, FDA, some other reputable sources, your local health agencies, Department of Health, just to make sure that you're getting accurate information. And really talk to your provider, your primary care provider or any other provider that you're comfortable with, to make a shared decision on when is the right time, that when it comes to return, what are your fears? What are you really concerned about? So they can talk about it and make sure that those are being addressed. It is certainly not a great time to start, going outside of your normal comfort zone because of all the unknowns and uncertainties. But there's a lot of resources out there to get people the right information that they need. So I hope everybody gets the correct information and gets vaccinated, and we can sort of progress all together to a better future.
It's a team effort. Well, I appreciate you just giving us the straight answers, not sugarcoating it and not doom or gloom either. So just Dr. Akavan, thank you for coming on the show.
I appreciate you having me. Thank you.
Thank you, Dr. Akavan. I really appreciate that sentiment of stay informed and check your sources. It has been almost a year now since this whole COVID thing first started happening. And one thing that I like to think about for myself is that bad or good even, change is inevitable. It is not going to be like this forever. So, on behalf of Family Education and Support Services and myself, Bobby Williams, this has been the Parental Compass. We'll see you next week. Peace!